Good afternoon, everybody. My name is Grant Loomis, Vice President of Government Affairs for the Buffalo Niagara Partnership, and on behalf of our President and CEO, Dottie Gallagher, I want to welcome you all this afternoon to our latest COVID-19 related webisode, Contact Tracing, What Employers Need to Know. And obviously, based on the response that we have had to today's webisode, employers feel like they have a lot to know. We've been really pleased with the response that we've had from interested folks, understanding that employers play a very vital role in our public health response to COVID-19, and that contact tracing is an essential part of that response. I want to thank members of the Buffalo Niagara Partnership for making all of our programming possible, and so thank you for your continued support of our organization. And today's program would not be possible without the expertise and time of our two guests. So I'm going to ask Dr. Burstein and Director Stapleton to turn their cameras on and join us now. Dr. Gale Burstein is the Commissioner for the Erie County Department of Health, and Daniel Stapleton is the Public Health Director for the Niagara County Department of Health. Obviously, both of these professionals have been really front and center and on the front lines of our community's response to COVID-19 over the last many months, and their time is their most precious resource at the moment, so we really appreciate their willingness to give some of that to us and to Buffalo Niagara employers over the next hour or so. A little bit of housekeeping before we get into the meat of the program. Today's session is being recorded and will be made available on our website to both members of the Buffalo Niagara Partnership and non-members. Also, with regard to questions, we are not taking any questions in real time as part of this webisode. There's just too many people to do that in an effective way. But when we get through the presentation, I will detail how you can submit a question to be answered if for some reason we didn't cover what's on your mind as part of the program. And so with that, I think we're going to jump right in to our first question. And this one, we're going to start off with Director Stapleton. Dan, if you can give us sort of a broad brush overview of what contact tracing is. We've certainly heard a lot about it since we've all been immersed in everything COVID-19 over the last many months. And how does contact tracing play a role in the public health response to the pandemic?
Well, Grant, first, let me thank you for having me on the webinar. You know, the ability to be able to share information with the public is always key to us. When we talk about contact tracing is something we've been doing for decades and decades in public health. It's not new to us. It's something we deal with a long list of reportable communicable diseases, and this is one of them now, and one of the ones that's keeping us most active. But contact tracing really tries to identify a positive case, an index case, if you will, which is a term we use quite often, and then goes through our public health nurses or our contact tracers, whoever that might be, will then end up talking with that person, interviewing that person, finding out where they've been, who they've been in close contact with, who they've been closer than 6 foot for longer than 10 minutes, things like that. And then we identify those people and try to find out who's been in contact with those people. So it starts with one first case, an index case, and then we fan out from there. And the real purpose of it is to identify those people early so that you can make sure that those people isolate if they're positive, or they quarantine if they've been in contact with someone who is positive or has been somewhere where we've identified as an area of concern. So it stops the spread, or at least slows the spread at that time, and it takes a lot of work from a lot of public health people to make sure, identify those people quickly, thoroughly, assess the risk for them, and then make sure that those people stay isolated, but also have the services that they need. Not everyone has the services at their home. Sometimes their home isn't the best area for them to live, so we help them with housing if we need to, also assisted service, food, any type of services they need to make sure that they can stay isolated, stay quarantined as long as possible until their time is quarantine is over, and they can then go out in the public. So once again, something we've been doing for decades and decades, not new. A lot of well-trained professionals in our departments that do that on a daily basis, and they take their role very seriously because it's important to stop the spread right in its tracks as soon as possible.
Absolutely. So getting right to the heart of what we are here to focus on today, we'll turn to Dr. Burstein. What is the employer's role in contact tracing?
So as Dan so eloquently stated, the whole main purpose of contact tracing in the first place is it's first of all a case investigation. So investigating the case, making sure that the case was really diagnosed and with a test, confirm that, and then finding out from putting the case in isolation, remember moving that person out of the mainstream of society so they won't infect anybody else because they are contagious, and then finding out who their close contacts are, who they could have infected, and then reaching out to those close contacts and also removing them from the rest of the mainstream society so that they're possibly incubating. And so we don't want anybody who's incubating and could have an asymptomatic infection because they've been in close contact with somebody who is infected, infecting other people themselves. And so that's why we put those people in quarantine. So again, we're doing this to to break the chain of transmission in the community. So the employer's role is very, very important of this. As you can imagine that many people in our community are employed. And thank goodness our employers have done a great job of keeping people at work. And so so we really need to work with our employers at the health department to help us with the investigation, right? So say a case works at a certain business. So what we would do is speak to the HR person. So all this information is confidential. However, to be able to complete our case investigation, our disease investigation, we would need to speak with the case's employer to find out at the workplace who could have been a close contact to that case. It could have either been, say, a coworkers or customers, or anybody who could have been in close contact, which is somebody who has been within 6 feet of the case for at least 10 continuous minutes. So that is a close contact. And then then we get those names from the HR. And again, this is confidential. We rely on HR to be confidential with this information and not disclose this to any other of their employees. And then what we do with the contact tracers, they will contact each of those contacts and tell them that somebody that you've been in contact with recently has been infected with COVID-19. We're not going to tell them who their names are, but we are going to tell them that they have been a close contact, and then put those people in quarantine and explain what quarantine is, and again, remove them from the mainstream of society and have them be in just like one place for 14 days. If possible. However, we work with the contact's employers, if they are employed, to find out if they're an essential employee or a non-essential employee. Because if they're an essential employee, then we will allow that contact to go to work under certain conditions. So if their essential employee means that for the business, if that person wasn't there for the full 14 days of quarantine, will that business still continue to operate? Can somebody else fill in? Or can that person, hopefully do their work at home? So if somebody else could fill in for that individual and do the work for them, and the business would be able to stay open even though that individual would not be there, so we would consider that person an essential employee if the employer needs that person to be there for the business to run. If they can have somebody else to fill in, say that person was, for example, a cashier at a large supermarket, and there were 30 other cashiers, so they could have somebody fill in their shift, then that person would be considered a non-essential employee, and we would ask that person not to return to work. And so if somebody is designated as an essential employee, they can return to work only nowhere else, but they can go to work under specific conditions. And those conditions is that the employee has to be asymptomatic, no symptoms at all. They have to feel perfectly well, no cough, no fever, nothing. And then the employee has to be able to self-monitor. So they have to do a temperature check and a symptoms check for themselves upon just before they leave for work or upon arrival from work, and then twice daily, every day, whether they're at work or not. Also, the employee has to wear some type of facial covering while working for those 14 days of quarantine. So to try to prevent exposure to their coworkers and customers. Also, the employee, if possible, should remain over 6 feet from their coworkers or customers, or if they can be separated by a physical barrier like a plexiglass or glass window or by a wall. I mean, that is really optimal if that's possible. So if the person becomes symptomatic at work, they have to immediately leave work and isolate at home. And a contact tracer will be checking in with them every day, making sure they're okay. And they should also, inform their employer that they're not well, and we would strongly encourage them to get tested, because then they could be another case, and we'd have to start the investigation again with that new case. And also, the employee is required to maintain the terms of the quarantine when they're not at work. So it means they go from home to work. They can't stop off on their way from home from work to like pick up groceries. They can't go to parties. They can't go out to restaurants. They are quarantined at home when they are not at work. And then we're also, as I mentioned, strongly suggesting all close contacts, whether they're symptomatic or not, to get a test. About the best time to get a test is 5 days or more after they were last exposed, because we know that the incubation period for COVID-19 can be up to 14 days. And so we want to make sure that if they were infected, that the viral load is high enough. So we want to give the virus a little bit of time to replicate and get a high enough viral load that would be detected by a test. So we strongly encourage all close contacts, whether essential or non-essential, to get a test to try to discern if they are actually infected themselves. And that's important to know for their health, and it's also important to know for the safety and health of their coworkers and for their customers.
And doctor, to that point, if a contact, essential or non, gets a test, and if they go to one of at least the 2 state sites, they're able to turn those tests around. I've always been told between 48 and 72 hours. Does that, if the test comes back negative, can that person come out of quarantine, or do they need to stay in quarantine for the full 14 days regardless of the test result?
That is a great question. Even if their test results are negative, they still have to remain in quarantine for the full 14 days. Because remember, the incubation period is up to 14 days. So if they have a test on day 5 of quarantine and it's negative, it doesn't mean that if they had a test on day 10, 11, or 12, that it wouldn't be positive at that time. So since we don't have the capacity to test people like every single day of their quarantine, we just have to assume that there's a good chance that they may turn positive sometime during their quarantine. Again, we'd like them to get tested just so we would have confirmation if they do turn positive, and we can do an investigation and find out who their close contacts were if that were the case. However, the quarantine period is 14 days, regardless if it's a negative test or regardless if it's essential or non-essential employee.
Okay, great. That's good clarity. You touched on the next 2 questions in your previous answer, but I think we should lean in on them just a little bit.
Sure.
Does the county health department notify impacted employees about a positive case, or is it the responsibility of the employer? And what I heard you say was the county health department would do that. So can you walk people through how that process works, if it's in person or over the phone, in writing, what have you?
Sure. So so first of all, the case would get their information that they are infected. usually from the healthcare provider that orders the test, or if they went to a county site or a state testing site to get tests, that either the county or the state, whoever ordered the test for them or collected the specimen would give them their test results. So, and that's the same thing is true if, say, people were tested at an urgent care center, the physician at the urgent care center would contact them about their positive test result. So at that time, we would hope that the employee would notify the HR or the owner of the company they work for to let them know that they're positive. And then when the contact tracers do the disease investigation, we would ask that infected individual about their employment situation and get information about their employment. And they would tell us they work at a certain business, and we would ask for information about their HR person who we should contact to help with the investigation. And so then we would reach out by phone and speak just confidentially to the HR person or the owner of the business, whoever is designated to help with the investigation, and get as I mentioned, the potential close contacts either as coworkers or as customers. So again, this is confidential information. We would expect that the HR person, whoever we disclose this to complete our disease investigation, would not disclose this to other employees. This is confidential information.
And so the next question, again, that you addressed, but just for clarity for folks, the steps that are required for employees that had contact in the workplace with someone who ended up testing positive, that is a 14-day quarantine and all the rules and regulations that apply there. The only exception would be if they're deemed an essential worker, they could report to work under certain conditions.
Right, and then also on our Erie County Health Department website, I can't speak for Niagara County. We actually on our COVID-19 website under businesses, and we have a form that employers can complete, and also a link to an email address that they can use to inform us if they know that they have an employee that has tested positive. So again, it's to try to prevent anything falling through the cracks, making sure that we are able to get that information however possible. So either through the employee, and if the employee may not give us like all the information of where they work, then we can also able to get this information from the employer.
Okay, very good. We're going to turn back to Director Stapleton. We're hearing the term close contact a lot in terms of how that's defined in the process of contact tracing. So what steps should employers be taking now to help them assist you folks in the process of contact tracing? So said another way, it's imperative, I'm assuming, and I know many businesses are doing this, that you are keeping some sort of records about who is interacting with who.
Absolutely. We say every employer should have a business plan, a plan on how they're going to be planning, preparing for the possibility of having a positive person. You also look at things like, in that plan would include things like trying to reduce the number of people who have interactions with customers, having less people doing that, having making sure that staff are educated on what they should be doing in terms of 6 foot and masks and so on. Those things sound common sense to us now because we're hearing it over and over, but it's never too often to tell people that they should make sure that they're eliminating interactions with others as much as they can, having very few people interact with customers, having a plan on what you'll be doing for that. We talk about a continuous log. Keeping a continuous log, have someone who's responsible for doing that. Don't assume everyone's going to do it. Have someone who has a continuous log of interactions people who've had with meetings, face-to-face meetings, interactions with customers, those types of things. So if there ends up having a case at your work site, you're able to identify who was in contact with that person, what customers came in, things like that. And you really don't want to wait until that happens to have a person responsible for the log. We're going to keep the log, what you're going to keep in that. You know, the New York State Forward website has information on having those types of things that you're going to want to keep. The CDC also provides guidelines on what kind of information you need to keep if you're going to be an employer that has customers coming in or employees interacting on a regular basis, on a daily basis. So less face-to-face meetings, things once again that we need to remind people about, using technology when you can. Don't have people sharing pieces of information on paper. Those things that we think are common sense aren't always common sense, so we need to make sure that people are trained and prepared for those types of things. So, like I said, New York State DOH, New York Forward site has examples of that and what you can use, but the key is having it beforehand, don't waiting until you have your first case, but just eliminating as much face-to-face, person-to-person contact, whether it's with employees or whether it's with customers.
And in terms of keeping these records, if I'm hearing the earlier definition correctly, we want to be capturing, what's most important is that we're capturing this close contact, right? So that's, if I'm hearing correctly, it's someone who you've had contact with in terms of less than 6 feet and for 10 or more continuous minutes. Is that correct?
That's correct. You know, as Dr. Burstein had mentioned, it's that close contact. People should not be interacting with anyone without masks. That's what we're telling people. Common sense things, but make sure you're wearing a mask. If you talk about the one thing that can protect, an employer wants to protect their staff, they also want to protect their customers. So we're helping you with this information so that you know how to protect your customers and your staff. So, you know, the 14 days is the incubation period, but we want to make sure people are keeping this continuous log and keeping it and having it on hand, not waiting and not discarding it after 14 days. That doesn't help us when we have to, if we have to contact you past that date. So making sure you keep it for longer than that, but it's a continuous log. It doesn't just stop. So keep that, and you should start that now. You shouldn't wait until you get your first case, because then you're playing catch up. So we tell people a continuous log, one person who's responsible for that to make sure that it happens. Don't assume someone else is doing it. And then making sure that you take actions now to reduce interactions with both between employees, but also between customers, because we want to make sure, and that includes vendors. People who come in to bring off in supplies, those types of things. All those continuous contacts need to be logged, you know, from now on.
And you've hit on question 6 here, which is if employers have not already, and I know many are, they should be starting this logging process immediately, and they should just keep it running until further notice.
Yes, you know, like I said, don't wait until you have it. So start it today, but the plans are provided for people to all this information is available online through the sites I mentioned. So make sure you take advantage of those types of information. They'll tell you the best way to do that. But yes, don't wait. Start doing it right now.
Doctor, anything you want to add? Oh, I'm sorry, Director. Go ahead.
Make sure somebody knows who's responsible for it. Don't assume somebody else is taking a log of the meeting you just had. Everyone should be making sure they're responsible for it.
Doctor, anything you want to add on this point?
Yeah, I mean, you know, the logs are actually key for us because the health department, and I know this is leading into one of my future questions, does notify all close contacts from you know, businesses, and businesses will not notify them. So we really need you all to keep a good log. Like, for example, we've had outbreaks of where staff at say, you know, hair salons or barbershops were positive, and so we had to find out who all those customers were, where they case could have had did have close contact with all those customers during the time that they were working where they were contagious. So it's you know, it's really important to keep those logs, and it'll just make it smooth sailing. Because if you know, we have to note, it's our responsibility to notify all close contacts that they have been exposed to COVID-19 and they could be infected. And so if you give us a list then of who all those close contacts be, we will contact every single close contact and notify them. But if we have no way of knowing who their close contacts were, then we would have to say in the media that there was somebody who was contagious at this business during this time. And so if you were at this business, you could have been exposed and you know, should get a test and self-quarantine. So it's just cleaner if we can just, if we know who the close contacts are and we can just directly notify the close contacts. If you know, a business wants to go ahead and make their own announcement about a case in their establishment, you know, that's up to them. I mean, we would never do that unless we were doing it out of desperation to complete the disease investigation. But we would much rather have names, have contact information, and just go, you know, one by one and contact each of the potential close contacts. So that's why also for, you know, customers in the store, you know, hopefully they'll be playing, you know, cash is not PC anymore because of the potential for, you know, exposure with, you know, touching cash. And so hopefully most of your customers, if they have to pay, will pay with a credit card. So it would be much easier to obtain the contact information for those customers that were in close contacts with one of your employees. And also just remember that CDC is now telling us that, and science is telling us that up to 40% of people who are infected don't have any symptoms. So 40%. So it can be very easy for one of your employees to be infected and they have no idea because they don't have any symptoms. So it's really important to, as Dan said, to, you know, keep those logs, and then also to you know, keep your plan, and keep everybody in compliance with your plan with masking and doing everything as possible virtually if you can.
Because just to underscore, even though that person may be asymptomatic, doesn't mean that they are able to spread the virus to someone else.
Right, they are still contagious. I mean, we all talk, right? And so there's just the normal droplets that come from our mouths or that we exhale when we breathe. We all breathe, you know, could be infected. So people don't necessarily have to be contagious to, I mean, symptomatic to be contagious.
Next question, back to Director Stapleton, and we've touched on this, but I think it's worth repeating. Walk through the process of, now we're not talking about a fellow coworker, but again, if someone at a business tests positive, how do you handle the interactions with a customer, with a vendor, someone who isn't employed by that business?
Well, obviously we don't tell them the information about the person who's positive case. We can't do that. We won't do that. But we work with the employer to make sure that we'll help them with identifying, crafting a message if they need to contact their vendors, people who visited their facility. Help them with crafting a message that will tell people what details we can give out, and then what they need to do to continue to make sure that they're safe. So it's not something we don't make an announcement unless, like Dr. Burstein said, we had an example. We had a casino, a person who works at the casino. That is a lot of our worst nightmare, that somebody who works in a casino is a positive case. But you work very closely with the employer to make sure they understand what the situation is, and then the employer will ask them to do a release or to contact their customers, their vendors, people who visited, people who might visit, to let them know the situation is. We educate them on what they can share, and also the point of us working with them is to make sure that they educate their customers and vendors and so on. So it's something we take very serious. A basic tenet of public health is educating the public, but also we like to educate the employers so they can protect their employees and their customers. So we work very closely with them to craft a message. Earlier in the pandemic, because people were not following the guidelines they needed to follow, we would mention businesses that the person might have visited because people you know, wanted to know about that. But now, as we've gone through the pandemic, we need to assume that everywhere we go, the virus is there. Don't expect, because someplace hasn't made an announcement that they had a person positive, don't assume that they don't. They either don't or they haven't made the announcement. But we like to tell people, expect it, assume that everyone is at risk, and do these simple things that we can all do: masks, social distancing, washing your hands, sanitizing your hands. Those things are really very simple, but we need to remind people then. So if they make an announcement to their customers, they have to make sure they educate them as well. And we work with them to make sure they do that properly.
Great. Okay, next question. We'll go back to Dr. Burstein. Should employers be thinking about this process beyond the possibility that one of their employees tests positive? Do they have a larger role in contact tracing?
Well, I mean, their role is actually to help our health department contact tracers complete the investigations. So the health department will contact all named close contacts. It's not the responsibility of the employer. The employer, I mean, that's really confidential information. And so, they really should not be contacting those close contacts. It really needs to be done under the auspices of the local health department, because this is a health issue. So, there could be, a lot of different, scenarios where, we would contact the close contacts. So, we'd say, somebody, as I mentioned earlier, could be, working at a hair salon, cutting hair, and they found out that we were positive. So we would get the names of all their customers and their coworkers, and then notify all of those individuals that they were close contacts to somebody, in the past, whatever whatever time frame that we got, and place them in quarantine. Or there could be a another scenario there. Somebody's working in, say, a law firm, and they have in-person meetings with their clients, where they are closer than 6 feet apart during the meeting. In that case, we would have to notify the clients that they have been close contact to a case, and put them in quarantine. So, and remember, the definition of a close contact is somebody who was within 6 feet of a case, of somebody who is infected, for 10 minutes or more of, continuously. So if, if they were, say, in the same business, and for a whole day, and they had several different interactions, each interaction was just 2 minutes, and then it added up to more than 10 minutes, but each individual interaction was just like 2 minutes or 1 minute, that wouldn't count. It would be 10 continuous minutes. So, employers should think about that proactively as they develop their policies and procedures in the workplace. Masks greatly reduce the risk of transmission. However, if even if somebody's wearing a mask, if they meet that definition of a close contact, we would still need them to be in quarantine, because we're not there. We can't see that they really are wearing a mask correctly. We know that's another thing that employers can help us with, is that ensuring not only that their employees are wearing a mask when they're around other people, and that also that they're wearing it correctly, that it's covering their nose and their mouth. If they have a face shield, that's great, because that would also cover their eyes. But I see a lot of people around that remove the mask when they talk, but that's when they're going to be transmitting infected droplets, or they might have the mask under their nose to help them breathe more easily. But again, then they could be transmitting infected particles through their nose when they breathe. So if people feel uncomfortable wearing a mask, if they don't feel that they can breathe right, some type of plastic facial covering, I'm sure you've seen them in the media or advertised somewhere, is also an acceptable barrier. And that's also good because it covers your eyes too. So whatever people can do to wear masks, but again, it's very important that the business discloses this information to the health department, and the business does not have to notify the close contacts. That's our job.
but to go off script just for a minute, it would be okay for a business just to acknowledge internally that there's been a positive case without disclosing any personal information, correct?
Yes, that's true.
Because I know we work with some members who have either had a case or mostly people just thinking about proactively how they would handle it. And they feel like from a transparency standpoint, they would feel more comfortable acknowledging reality and then letting people know that if need be, if they haven't already, they would be contacted by the health department with any specific steps they would need to take.
Sure. That's because that's completely appropriate as long as the information about the specific case is kept confidential. And also, people who are placed by the health department in quarantine or isolation if they're infected, that's a legal transaction. Those they're being placed by commissioner's orders that have legal teeth to them. And so, employers really don't have that type of legal power of authority to place people in isolation or quarantine.
All right, so next question hits again on some of this, what an employer has the ability to know or not and what's private. So to Director Stapleton, does an employer have the right to know an employee's COVID-19 test results or to verify that an employee went for a test, that they've had a test conducted?
Well, as you mentioned, we just covered that, but no, an employer does not have the right to know the results of a COVID-19 test on one of their employees. They don't have the right to know whether the person was tested. That's why we need to get those contacts and have that's a piece of the puzzle that the employer has, is the list of contacts. So we'll get a notice about that. We will not be able to share that with the employer, but we also like to have the list of contacts that the employer keeps, so we can contact those people, find out what the exposure might have been, if there was, how close were they to the person. But we also always need to make sure our number one concern is confidentiality. We do not, no matter how badly the employer wants this information, we cannot tell them the results of the test, but we appreciate the log of potential contacts so we can follow up with that. But we've also, when we contact those potential contacts, we won't say who had the positive test results. We can't do that as well. So it's being able to ask the right questions, getting the list of contacts from the employer. That's key. But unfortunately, the employer doesn't have a right to know that type of information. They have the right to know that someone was working at their employment and was positive, but we will not be able to tell them who that was. But key that we have that list of contacts so we can follow through with that.
So just to sort of underscore this, if you're not telling them who, how do they then produce for you an accurate contact list, right? Or you're just looking for contacts company-wide? Because
they keep contacts, that log, a thorough log of who was in meetings, who is at the front desk, once again, trying to reduce that amount, who was interacting with customers, who the customers were. Those are the types of things we need in this log. It's a very thorough log that people keep. It's continuous. When I say continuous, it means that it doesn't stop, to make sure we have that list of people. But no, we don't need to tell people who the positive was in order to identify whether they had a contact, because we'll have that on that log.
And, I just want to add that, actually it'd be, just to look for like a reference of, what's legal or kosher. You can go to the guidelines that OSHA has published, or the Department of Labor or EEOC. Work with the employers who work with their legal counsel to try to determine, what is acceptable to do in the workplace. But, as Dan said, that when we notify the contacts from the workplace, we won't say who it was. However, to get that information, who the contacts were at the workplace, we will have to talk to just somebody in HR who's been designated, or the business owner to, figure out who that, and tell them who the individual was confidentially, to be able to get the names of all the close contacts in the workplace. But we can't tell, but we will never disclose to those other individuals in the workplace, who the case was that they came in contact with. But
All right,
again, it's confidential information that the employer, either, the designated contact person, either HR or the owner, would need to keep this information confidential. I mean, they could get sued too.
Sure. Okay. I want to just reiterate this because I was a little confused. So I imagine someone else participating is confused. The health department would never share with the employees at large who the positive case is, but the health department would identify the person in confidence to the correct HR or designated person at the company who you're working with to help produce the best logs for you to do your contact tracing.
Right. So, as an example, I mentioned with, say, somebody working at a hair salon, it could be like one of these really big hair salons where they have, 10 different stylists. And so, they'd have to know who the stylist was that was infected, because it wouldn't need to be every single customer that walked into the shop necessarily, depending on how, hopefully the shop is structured so that all the chairs are at least, 6 feet apart, and, people aren't hanging out in the waiting room close to each other. But, so theoretically it would only have to be contacting the customers who were in, who were serviced by that one individual employee.
That's why the log is key. You want to try and use that log to identify those individuals. That's the whole idea behind the log.
And if a company doesn't have a dedicated HR person, I would suspect that the business owner then is your point of contact?
Yes, that's how we would contact whoever has oversight of all those employees in the operations of the facility.
Okay, and Doctor, again, our last prepared question is, again, speaks to this: what's confidential, what's not, and we've hit on this, but just to underscore, what part of this process is considered public information and what part of this process is considered public? Because as you can imagine, if there is a case at a work site, people will feel anxious, and it's reasonable to suspect that employees will be asking, maybe demanding from their employer information. Who is it? Who is it? Because, it's natural people want to sort of gauge their level of risk or exposure, right? But it's very clear what information an employer can share, what information an employer has access to in the first place, and the role of the health department in being the one to communicate.
Right. So the health department will not disclose any specific information to anybody about the case, except to further the progress of a case or a disease investigation. And so then we would have to disclose at least the name of the individual and the dates that the individual worked at that facility where they would have been contagious to the HR person or the business owner. But that is only because the goal is to be able to complete the disease investigation. However, nobody else is in the need to know category. I know a lot of people are in the want to know category, but it doesn't mean that they're in the need to know category. So we have to keep this information confidential and respect individuals' rights to confidentiality and be respectful of their personal information. And it's not just being, respectful of their personal information. The employers could get sued if they disclose confidential information about their employees.
Absolutely. All right. So that takes us through our prepared questions. Would welcome any final thoughts from either of you as you sort of think through this task of contact tracing and how critical it is to making sure that our community works through COVID-19 as quickly and as efficiently as possible. Yeah.
So I just like to say that COVID-19 is here. It's in the community. And if I were a betting man, if you have a large business, I would bet that you will have at least one employee that sometime during this pandemic, because we don't know how long it's going to last, will either be a case or a contact. So please don't get freaked out. Just expect it to happen and be prepared. Preparation is very powerful, and putting in place what you need the information you need to have to help a disease investigation will just make it easier for all of us. And then also putting in policies in place to mitigate the risk of community transmission within your facility is also really helpful. I mean, we have given up so much in this pandemic. I mean, businesses had to close. I mean, people have really, been, suffered like business losses, a lot of income losses, job losses. And now that we're finally reopened, and we're not reopened because COVID-19 is gone. We've reopened because we put systems in place to help people make smart choices so we will be able to decrease transmission in our community. And if we ever let down our guard, we will end up like one of those 31 states on the governor's travel advisory that has out of control COVID-19 rates. And so we all have to do our part, and businesses are an essential component of our prevention efforts.
Grant, I'd like to consider this a partnership. The local health department is partnering with the employers to make sure you can protect your customers and your employees. That's why we're doing it, and we can't do it without the employers and without the employees. Without that, this job would be impossible. So we consider it a partnership. We look forward to answering questions when people have questions, but now is the time to make sure that plan is put together and that log is done. As Dr. Burstein mentioned, we are not just because the numbers are getting better, and that changes day to day. But just because the numbers are getting better doesn't mean we're anywhere near the halfway point of something like this. So it's a partnership, and we welcome the employers to give us a call if they have questions.
Great. Thank you both so very much for your time and expertise today. We really appreciate it. In terms of questions, I would encourage everyone who's listening, if you have one, to please go to our website and click on the BNP business link. There's a very short form to fill out where you can ask your question. We have a group of partnership staff members who are dedicated to getting you a response in a timely way. And if we already don't have the information, we have a network of professionals who are willing to help us answer those questions for you. And so this is a service that's open to certainly our members, but also non-members. So we would encourage you to avail yourself of the BNP business link and ask your contact tracing question. Of course, you can also contact your appropriate county health department directly. Here's the information for both Erie and Niagara. Erie has a dedicated COVID-19 website at erie.gov/COVID-19 and a hotline 858-2929. The Niagara County Department of Health, niagaracounty.gov/health 439-7430. They would welcome your calls and inquiries. I would be amiss if I didn't put a plug in for our next webisode. So we are doing something later on in August 20th, around PPP loans. Obviously, many businesses in our community applied and received Paycheck Protection Program loans. They were essential to helping this community navigate the initial months of COVID. And now, obviously, there are a lot of considerations to take into account regarding paperwork, eventual audits, things that you need to have in place now as you work your way through that loan. And so Hodgson Russ, a member firm, is going to be walking through those steps for individuals. So if you have interest in this kind of content, please visit our website on the events page, and you can register today for this webinar. And as always, you can visit our website for COVID-19 related information. We have the whole resources and impacts page. A lot of the information that the professionals are sharing with us today is on our website, along with our Keep Buffalo Niagara Working document, which is a dynamic, routinely updated document with all the latest information around federal and state health policy, all the reopening guidelines, everything you need to know to be conducting business in the times that we find ourselves in. So again, thank you all for participating today. I'm confident that you found this information helpful. And again, Director Stapleton, Dr. Burstein, thank you so much for your time. And we wish everyone a good rest of the day. Take care.
Thanks for helping us deliver the message.
Of course, our pleasure. Take care.